report shows access to mental health care continues to be a major problem here in Maine, and experts say it isn't getting better.
The latest community health needs assessment here in Maine shows access and insurance are major barriers to care. CBS 13's Anna Kuhn joining us live in the studio. And Anna, this isn't a new problem.
Yeah, it's not, Greg. This is a survey that's done every 3 years, and the need for increased mental health care access is a consistent finding. But this year's report comes amid recent closures of care centers.
It's definitely not getting better.
The 2025 Maine Shared Community Assessment Report highlights the needs and health priorities of Mainers across the state. Heather Drake, who oversees that program, says when it comes to mental health, access continues to be a problem. The report says there's one psychiatrist for every 11,000 people in the state. So it's not surprising that wait lists are long.
This is not just specific to psychiatrists, but across the board with any providers, is difficulties with recruitment and retention.
That problem is exacerbated by recent program cuts, like the end of some mental health help at Community Clinical Services in Lewiston. Back in April, a patient there told us he was nervous about finding replacement care.
It's a waiting game. I just don't know the resources that we have or what I'm going to be able to find.
And Drake says even if a provider does have availability, a lot of survey responders said they couldn't find care that accepted their insurance, especially when on Maine Care.
People really experience difficulty regarding insurance, specifically people who have Maine Care find it really difficult.
And programs that do accept Maine Care say they're struggling. We saw that in May when budget cuts forced Maine General and Augusta to end psychological evaluations at the Edmond Irvin Center.
It is almost impossible to get a good psych eval today if you can't pay for it out of pocket.
That report also highlighted that suicides in Maine continue to be in the state's top 15 causes of death. Now, the next step for this report is for Maine's major hospitals and providers to release a plan to fill community health needs. Live in the studio, Anna Kuhn. Back to you guys.
Anna, thank you.